Welcome, everyone. Thanks for joining us today. As Barb said, the new course that we are running, and I am very excited about doing it because as an independent auditor, we see the need for this. Over the years, we've had a lot of focus on risk-based monitoring and a lot of chatter about that, and even some guidance, of course, from the FDA. But we forget about auditing oftentimes and how it fits into the role of making sure that we have trials that are being conducted so we're getting good data from protected people. Even the FDA considers quality assurance units to be optional, but as we're going to discuss, if we do have them, they have certain expectations for those. So let's look at some of these issues. We're going to look at, initially, some basic terminology that you're familiar with. But we're going to first glance through our learning objectives. We're going to look at some of the similarities and differences in risk-based auditing and risk-based monitoring. Again, a lot of focus on risk-based monitoring. We're going to look at the structure of quality assurance and quality control and how sometimes those lines are a little blurred and how it can impact on the conduct and oversight of our studies. We're going to look at risk assessment and risk management principles brought to us through ICH Q9 and a lot of the other information and documentation we have seen recently, including the EU's reflection paper on risk management and clinical trials from November of last year. We're going to also talk about risk-based auditing and how it compares to some of the traditional auditing and practices that we see in play. We'll look at how the timing of the audit and making a determination from a risk assessment when we should be doing our audits, how that impacts on our control of those studies. And of course, we'll look at the FDA's compliance issues that they've identified recently as well. And we'll discuss how timing of audits or maybe having a risk-based approach could have helped determine some of those issues before they started, or at least secure compliance from different entities before they started.